Hello, it's Dr. Rhonda Johnson. Today is Thursday, August 18th, 2022. Today I'm discussing long COVID in seniors. Now first, a review that long COVID refers to ongoing or new health issues that occur at least 4 weeks after COVID infection. Now sadly, 3 years into this pandemic, there is still no standard definition or even naming agreement about what to call this. Long COVID is also called post-acute COVID syndrome, post-acute COVID, and long haulers disease. Now, doctors and COVID experts cannot predict who will be affected, and there's no single diagnostic test at this time. That's probably because the virus involves so many different organ systems. Now, when it comes to long COVID, in terms of underlying etiologies or what causes this, there can be multiple pathways, including immune system dysfunction. The viruses can be hiding out in certain organs. We call this viral reservoirs, or it could be tiny blood clots to major organs, such as the heart, lungs, blood vessels, brain, kidneys, and male reproductive organs. Now, in February of this year, an article was published in a British medical journal which showed that adults ages 65 years and up have an excess risk of long COVID after acute infection. Now, the authors estimated that 32 out of every 100 individuals ages 65 and older who have had COVID have a diagnosis of one or more new clinical sequelae that required medical attention. Now, they looked at reviews of thousands of charts, and they found that some of the higher, more prevalent conditions in adults 65 years of age post-COVID included chronic respiratory failure, diseases of the heart, including cardiac rhythm disturbances and acute coronary syndrome like heart attacks, hypercoagulability, that's blood clotting, neurological disorders such as encephalopathy, dementia, memory difficulties and stroke, kidney injury, diabetes, and anemia. Now, these increased risks for these conditions were greatest among people who were admitted to the hospital, and for men, and for people who were Black, and for people who were age 75 and up. Now, one caveat is that this study, this British Medical Journal paper, was done during the infection wave by the original Wuhan strain and not during the Delta or Omicron waves. So I don't know if this data can be extrapolated to Delta and Omicron. But nonetheless, if you have loved ones who are 65 and up who had COVID, please don't just dismiss their symptoms or assume this is part of normal aging. And please don't assume that their post-COVID changes are due to a progression of conditions that they may already have. If you're listening to this message and you're a senior, please have a doctor evaluate you. Or there are some hospitals and academic medical centers that have these long COVID clinics. That's my message today. As always, I appreciate you watching. I hope you learned something. I hope there is something that you can act upon that will make a difference in your health. Take care and be well.